sometimes both. And the etiology is not known. These are all inflammatory conditions. So a few headings which you can put in every disease are: number one, what are the findings of fluorescein angiogram? FFA, पहले हम इनको कहते थे fundus fluorescein angiography, FFA. Now American terminology is fluorescein angiography, FA. So most of the lesions are hypofluorescent. सारे बोले जरा hypofluorescent. So fundus fluorescein angiography या FA पे जो finding है ज़्यादातर में ये है कि पहले वो hypofluorescent है because they block the choroidal circulation, और बाद में वो hyperfluorescent है because they are stained, वो dye को retain करते हैं, so they are hyperfluorescent. Now the other investigation is autofluorescence. So autofluorescence tells you about the RPE damage, the extent of RPE damage. So most of the lesions are hypo-autofluorescent. सारे बोले ना hypo-autofluorescent. So this is the difference between fluorescein angiogram and autofluorescence. So there are different findings on the autofluorescence. Whenever there is RPE damage, then these will be hypo-autofluorescent. Now the third investigation is indocyanine green angiography, ICG, and the lesions which are involved, the choroid will give a hypocyanoscent spots. बोले ना hypocyanoscent. So previously it was hypofluorescent drops, spots. Now this is hypocyanescent spots because these involve the indocyanine green dye. Then the fourth investigation is OCT, and on OCT you will, in most of these conditions, you will find what you will find. Number one, macular edema, cystoid macular edema, macular thickness is increased. There is ellipsoid layer damage, which was previously known as ISOS junctions. So that shows that the VN is grossly disturbed. Whenever there is ISOS junction disruption, ellipsoid layer damage, then the VN is decreased. And the new OCTs now show they have a feature of enhanced choroidal resolution. So they show most of the choroid, and you will find that the reflectivity of the choroid is increased in the early stages, and in the later stages there is choroidal thinning. Similarly, in the later stages of many diseases, there is a retinal RPE and outer retinal layer atrophy. So the thickness of the retinal layers is decreased. So in every disease you will make these headings. Number one, fluorescein angiogram. Number two, autofluorescence. Number three, ICG. Number four, OCT. Okay, so how to differentiate between a hypofluorescent spot that later stains with the dye on fluorescein angiogram and CNV? What is the differentiating point? In CNV, the fluorescein, because it leaks from the new vessels, so the initial spot will be hyperfluorescent, and the area of leakage will increase in the later stage. So whenever there is CNV, we will consider anti-VEGF, and if it is extrafoveal, then we will consider laser. So we have to differentiate whether the hyperfluorescence is because of the advancing edges or the fresh lesions on the choroid and the retina, or because of CNV, because the treatment is different. If the choroid and retina are involved, then we will start with steroids and early antimetabolites. Right. So white dot. The most important thing is that we have to exclude the infectious cause. So in differential diagnosis, I will put which disease as number one? Tuberculosis. So I will put the tuberculosis number one, and then maybe syphilis, and then maybe ocular histoplasmosis syndrome. So you have, because these are treatable conditions which give 100% cure, the infections can be treated. The other conditions which are non-infectious like sarcoidosis,